This is week 6 of the HSA520 course, and this week the material concerns government regulation, and it also concerns the implications of government regulation of hospitals and other healthcare providers for information technology within the organizations. It also involves the privacy of medical records and disaster preparation. You may be of the opinion that government should simply stay out of it, that hospitals and other healthcare providers should be able to do what they want to do, that the market should be the means by which important decisions are being made about what services that hospitals and others provide and who can receive those services. That's not an unusual opinion. However, I would like to make the case that government does need to be involved, because markets in this instance will not produce the outcomes that we as a democratic society and a humanistic society would want to happen. Let's make a comparison to the production and distribution of tennis shoes. The market is entirely adequate to, in my opinion, to decide how many pairs of tennis shoes are made, what kinds of tennis shoes are produced, how they are priced, how they are distributed, who has really snazzy tennis shoes and who doesn't. But healthcare, medical care is different for several reasons. People die because of the lack of appropriate medical care. I don't want to live in a society in which people die because they cannot afford the medical care that they need. Also, each of us has an interest in the health of the people around us. If the people around us have communicable diseases, we are more likely to catch those communicable diseases. So, I have an interest in my neighbor having access to good health care, because otherwise I may wind up with something that otherwise I would not have if my neighbor does not have good health care. Most people have some sense, to one degree or another, of what is called social equity. Social equity is basically the idea of fairness, that the world should not be such that a few people are very rich and many or some people are very, very poor, in a situation in which there is no opportunity for people to improve their lives and to rise up through the system in terms of income and health and other important factors. Some people argue that the regulation of medical care by the federal government and state governments in the United States constitutes socialism. Well, we could debate upon where to draw the line. We could debate upon whether or not socialism is necessarily an evil thing. But to do so would be beyond the scope of this course. The fact of the matter is that federal government is involved in the regulation of healthcare services, and I know that many people believe that that is appropriate and necessary. Now, one of the major regulations in recent years is the Health Insurance Portability and Accountability Act of 1996, commonly referred to as HIPAA. It has a lot of provisions in it, and it's beyond the scope of this course to try to go into many of them. One of the things that it provides is that when people lose their employment, they can, at least for a time, continue their medical insurance coverage through a program called COBRA. The problem is that this kind of insurance is very costly, and it comes out of the pocket of the now unemployed person, but that's another story. This law, passed in 1996, has provisions regarding privacy of medical records, and it is intended to simplify the management and exchange of medical information. Efforts to simplify something often are not simple, and basically it is an acknowledgement that in order to make our medical delivery system in the United States function in a reasonable and cost-effective way, records need to be kept. They need to be kept according to standards, and that information needs to be able to be moved electronically among providers. And this law in 1996 was a step toward requiring providers to gather information about people's medical conditions and to make that information available to others, such as between physicians, hospitals, and insurance companies. We spend a lot of money in the United States on figuring out who owes who how much for what, and we cannot make those kind of determinations easily if we're not all calling things by the same name, formatting information in the same way, and making that information available to others through standardized protocols. Finally, in this chapter, I would like to touch on the fact that the material reflects disaster preparation. IT professionals need to be concerned not just about backing up data, which is obvious, but also about how to keep the organization running when something awful happens, like a flood, a fire, a tornado, other kinds of natural disasters, or even acts of terrorism. There are risks that we can anticipate and can mitigate. Mitigate means, kind of ensure or try to take action in order to prevent. But it is not enough simply to back up the data. Most organizations, if the information system is down, simply no longer function and may even cease to exist after a short time. So hospitals and other healthcare providers need to have plans in place to be able to relocate their data processing information systems centers to other locations, even in other states, in the instance of a disaster. And this is not easy, but lives are at stake, and the continuation of the medical facility itself is at stake. I hope this has been helpful to you. Thank you.